going to say tonight started as something that I did in 1996, sitting at the table in a little practice that I started and worked at in Pawtucket. I had to figure out for the first time what it cost us to deliver health care, to deliver primary care to everyone that we took care of. And the math to figure out what it cost was actually pretty simple. The amount of money it cost to run the practice, including our salaries, divided by the number of people we took care of. And the number I got shocked me. The per person, per year cost of the primary care we delivered was $106. A number so small that I looked at it and couldn't believe it, because in those years, the per person per year cost of health insurance was $4,000. Now I knew, because I had had a little bit of health policy training, that the value of health insurance was really deeply vested in primary care. Most of the value of health insurance comes from primary care. It was one of those eureka moments that made me say to myself, well, if it's this inexpensive and this effective, why aren't we giving it away?
Primary care is the main or regular source of health care that you get. It's the person you usually see for your health care. Sometimes a doctor, not always, a nurse practitioner, physician's assistant. Evidence shows that primary care is the most effective, the most cost-effective way of providing care to people. Primary care is effective because it keeps people healthy. It does not cost a lot to provide, and it prevents those more serious and more costly health conditions from developing.
So take a minute with me and imagine a healthcare system. To me, a healthcare system is one primary care center for every community of 10,000 people that is a mile or two from everybody's house, that has many different kinds of health professionals, that's open again from 8 o'clock in the morning till 8 at night and open on weekends, and provides 90% of the health services the community needs, and does it in a way that 90% of the people in each community want to use that healthcare center. That's a healthcare system.
So imagine, if you will, in your neighborhood, we're used to a police station, we're used to a fire station. What if there was a place, more than a building, but a place that was our neighborhood health station? And the idea is that for every 10 to 15,000 people in the community, they would have their neighborhood health station. All the professionals that we needed to see, led by our doctor, would not just be co-located, but our care would be coordinated in that place. One of the benefits for the family is provide health care when the patient wants it and needs it. Ideally, the way an operating neighborhood health station would work is it'd be available Sunday through Saturday, really same hours every day. Now, they'd be voluntary. In other words, if people want to go to one, it's up to them. If doctors and other health professionals want to participate at one, it's up to them. So the thing is, it's co-located care. Everything care is all in one spot. It's interdisciplinary care coordinated with your physician. But it's really at one central place in giving you the health care you need beyond the usual checkup.
Well, neighborhood health stations, they really start with delivering the best care for you and for your family by putting together the best team to work with your doctor and give you all the services you need. What makes them unique is that they're also going to be supported and rewarded for taking care of the whole neighborhood. Through outreach efforts, through getting more folks to check in and maintain a relationship with the primary care provider, we're going to improve public health. So what you're going to have in your neighborhood is the best patient-centered medical home you can imagine, along with an engine to improve health in the whole neighborhood. When we do that, we're going to have healthier classrooms, healthier businesses, so we're going to have folks who are better learners, better earners, better productivity, and when we have that, we get that win-win-win of better health, better schools and workplaces and neighborhoods, and bottom line, we save money.
A couple of us did a thought experiment about 3 years ago and said, what would it be like if we could take everybody in the country and have their primary care supply, have the same number of primary care physicians as the best states in the country, the 5 best states? What would happen to heart disease mortality? So if we got primary care supply for the whole country, what it is in the best states, we probably have 102,000 less deaths a year from heart disease. We'd probably have 37,000 fewer deaths a year from infant mortality and 2,700 fewer deaths a year from diabetes, and we'd probably have 6,000 fewer deaths a year from stroke, 6,000 fewer deaths a year from cancer, which is about twice the yearly improvement we now experience with all our other cancer interventions combined. We would likely lengthen life expectancy by 1 full year, a greater improvement than occurred during the years 2000 to 2006, a time during which we spent more than $2 trillion a year, or a total of $8 trillion on health services. That all adds up to about 150,000 lives a year saved. And when you drill it down to Rhode Island, that's 500 Rhode Islanders.
One of the best things about this plan is that it's not going to cost you or anyone any more money. It's not about additional money. It's not about new money. It's about focusing and amalgamating money that's already in the healthcare system and applying it to the primary care trust, getting it to the neighborhood health stations, and getting you the best primary care possible. Now, what's in it for you and your family? When we do that, when we amalgamate the money and when we let your doctor get all of the bills paid from one source, then it cuts down on paperwork. So what we're actually going to be able to do is save money where a huge portion, maybe as much as 20 cents out of every dollar, is now spent by insurance companies doing the paperwork, and cut the paperwork from your doctor's point of view, where now they have to deal with so many different payers, so many different insurance companies, and it's going to make both sides of that equation more efficient. So it's going to free up time for your doctor to have more time for you. It's going to free up dollars in the system that now go to paperwork that actually go to health care, and it's a win-win. But the real bottom line to remember is it doesn't cost any more money to do it the efficient and right way. Bottom line will actually just be more services for you. Some of the very highest quality, best results, gold standard care in the country has a team approach that's funded more like this than anything you have now. The Mayo Clinic is probably a place you've heard of, and it's something along the lines of the way they do that.
There are a number of things that impact your health. Where you live, your education, your job status, the environment that you're raised in, all of these things impact your health. Because of the high cost of healthcare at the moment, we don't have funding left over for the things that we know impact health. The exciting thing about the neighborhood health station is that we know that the savings that we do save from the neighborhood health station can be diverted to things such as safe housing, safe places to play, and building safe communities.
This is a new approach that's been researched that we are confident has a real potential. But the bad news is no one's doing this right now. And that's one of the reasons why our country as a whole spends way too much money on medical care for way too few outcomes in terms of health. The good news for Rhode Island is we can lead the country. If we do this, move forward and get this right, we'll not only be healthier, we'll not only be more productive, but we'll also be saving money. One of the biggest drags on business is the cost of providing health care. And we can keep people healthier, lower insurance premium costs in doing exactly that, and have a real chance to make an economic game changer for Rhode Island.